Well, traditionally, colder weather in Texas is accompanied by more respiratory illnesses, and this year is no exception. If you're not sick, more than likely somebody you know is feeling a bit under the weather. Our medical expert, Dr. David Winter, joins us for an update on just what is going around these days. Good morning, Dr. Winter. What are you seeing out there?
Lots of infection, Tashara, lots of infection. If you look at nationwide, numbers of hospitalizations for COVID now up 15% from 2 weeks ago in adults, up 18% in children. Combined COVID hospitalizations with the flu, with RSV, they're up 35% nationwide. Numbers are pretty similar here in North Texas, so lots of infection out there.
Okay, as always, I got to ask you this. What are you recommending to your patients and even to your friends? What can they do to minimize the spread of infection?
Yeah, you've heard me say many times, most of these infections are spread through the air. Be careful around people that are coughing, sneezing. Be careful indoors. Tight crowds, masks still work. They're not very popular, but they can help. You can also get it, though, by handshakes, by high fives, by hugs. Washing your hands can help, but you got to wash them for 20 seconds. Count that. That's longer than most people do that. You can also keep your own immune system healthier, get adequate sleep, no excessive alcohol consumption, eat well, and moderate exercise. All those things can also rev up your immune system, make you a little less susceptible.
Okay. Now, when somebody becomes ill, and I know a lot of people who are sick right now, what are the best things, I should say, that they can do to hasten their recovery?
Yeah, if you're sick but don't need to go to the hospital, you should stay home, stay in one bedroom. Ideally have one bathroom just for you. If you don't have that, then have somebody disinfect it every time you go in there. If you need assistance, have only one family member help you. Don't spread it to everybody else. Have that one family member wear a mask and wear gloves when they come in. And how long do you need to isolate? Well, 5 days until your symptoms go away. Hopefully they're gone in 5 days. And then after that, you're probably okay, but some folks still contagious. So the official recommendation, wear a mask for another 5 days after the initiation.
Okay, are there certain symptoms, by the way, that indicate the need to go to the hospital or emergency room?
Yeah, there are. You know, I've got my thermometer here. This is important. Take your temperature frequently. If it's above 103 or 103 and higher, that's a problem. Watch your breathing. If you get short of breath, these little finger monitors to measure oxygen, these are helpful. If it gets in the low 90s or in the 80s, you need to call for help. If you get confused, weak, if you have trouble getting out of bed, not eating well, all those things, talk to your doctor or go to the emergency room or at least talk to somebody who can help you because this stuff can really be bad. And there's a lot of it out there. More family gatherings. I expect it's going to get worse, Tashara.
Well, Dr. David Winter, you stay healthy out there and I'll try to do the same. Thank you so much as always.
Indeed, to you too also. Thank you.
Thanks.